This Kamdoy Spray, non-aerosol, is used on the skin to stop itching and pain from certain skin conditions such as scrapes, minor burns, eczema, and insect bites. It can also treat minor discomfort and itching caused by hemorrhoids and certain other problems of the genital/anal area, like anal fissures and itching around the vagina/rectum. Additionally, it can decrease discomfort or pain during certain medical procedures/exams, like sigmoidoscopy and cystoscopy. The active ingredient, lidocaine, is a local anesthetic that works by causing temporary numbness/loss of feeling in the skin and mucous membranes. The recommended daily dosage and the best time to take this spray should be consulted with a healthcare professional. When using this medication, it's important to follow the directions on the product package if you're self-treating. If you have any questions, consult your pharmacist. If your doctor has prescribed this medication, use it as directed. Before applying to the skin, make sure to clean and dry the affected area as directed. Apply a thin layer of medication to the affected area of skin, usually 2 to 3 times a day or as directed. If you're using the spray, shake the canister well before using. Hold the canister 3 to 5 inches from the affected area and spray until wet. If the affected area is on the face, spray the medication onto your hand and apply to the face. Do not spray near your eyes, nose, or mouth. If you're using the foam, shake the canister well before using. Spray the foam onto your hand and apply to the affected area. Do not use on large areas of the body, cover the area with waterproof bandages or plastic, or apply heat unless directed to do so by your doctor. These may increase the risk of serious side effects. Wash hands immediately after use unless you are treating an area on the hands. Avoid getting the product in eyes, nose, or ears. If the medication gets in these areas, rinse the area immediately with clean water. The dosage is based on your medical condition and response to treatment. Do not use more of this product, use it more often, or keep using it longer than directed. If there is an infection or sore in the area to be treated, do not use this medication without consulting your doctor first. If your condition lasts or gets worse, or if you think you may have a serious medical problem, get medical help right away. When using Kamdoy Spray, non-aerosol, you may experience temporary redness, stinging, and slight swelling at the application site. If these effects persist or worsen, it's important to seek medical attention. If your doctor has prescribed this medication for you, it's because they have determined that the benefits outweigh the potential side effects. Most people who use this medication do not experience serious side effects. However, if you do experience any very serious side effects such as slow or shallow breathing, seizures, pale or bluish skin, unusual tiredness, shortness of breath, or fast/slow/irregular heartbeat, it's crucial to seek medical help immediately. While rare, a very serious allergic reaction to this drug is possible. If you notice any symptoms of a serious allergic reaction, such as a new or worsening rash, itching or swelling, especially of the face, tongue, or throat, severe dizziness, or trouble breathing, seek medical help right away. It's important to note that this is not a complete list of possible side effects, so if you experience any other effects not listed here, contact your doctor or pharmacist. If you have any concerns about the side effects of Kamdoy Spray, non-aerosol, contact your doctor for medical advice. Remember, always consult your healthcare provider to ensure the information displayed on this page applies to your personal circumstances. Before using Kamdoy Spray, non-aerosol, make sure to inform your doctor or pharmacist about any allergies you may have, especially to amide-type anesthetics. This product may contain inactive ingredients that can cause allergic reactions, so it's important to discuss this with your pharmacist. Also, inform your doctor or pharmacist about your medical history, especially if you have broken skin or an infection in the area where the spray will be used, or if you have any heart disease, liver disease, or a certain blood disorder. If you are going to have an MRI test, let the testing personnel know that you are using this product, as some brands may contain metals that can cause burns during the MRI. It's important to ask your doctor or pharmacist about your particular brand. Before undergoing any surgery, inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. For pregnant women, this medication should only be used when clearly needed, so it's important to discuss the risks and benefits with your doctor. This medication can pass into breast milk, but is unlikely to harm a nursing infant. However, it's important to consult your doctor before breastfeeding while using this medication. Drug interactions can affect how well your medications work and may even lead to serious side effects. It's important to keep a list of all the medications and products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It's crucial to always consult with your doctor before starting, stopping, or changing the dosage of any medicines. This medication can be harmful if it is inhaled or swallowed. If someone has taken too much and is experiencing serious symptoms such as passing out or difficulty breathing, it is important to seek immediate medical attention. You can call 911 or a poison control center for assistance. Symptoms of an overdose may include drowsiness, irregular heartbeat, and seizures. It is important to take this medication exactly as prescribed and to store it safely out of reach of children. Always follow the recommended dosage and do not exceed the recommended amount. Be sure to consult with a healthcare professional if you have any concerns about taking this medication. Make sure to keep up with your regular medical appointments and any scheduled lab visits. It's important to stay on top of your health and follow up with your healthcare provider. If you take this product regularly and forget a dose, take it as soon as you remember. If it's almost time for the next dose, just skip the missed one and take the next dose at your usual time. Do not take a double dose to make up for the missed one. When using Kamdoy Spray, non-aerosol, be sure to store it at room temperature and avoid freezing. Keep it out of reach of children and pets. It's important to also keep the gel or foam spray canisters away from high heat and open flames, as they are pressurized containers. Do not puncture or burn the container. When disposing of the product, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, consult your pharmacist or local waste disposal company for proper disposal methods. And be sure to discard the product and it is expired or no longer needed. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.